were much clearer then, and there was a case. Not a good case necessarily, but there was a case. Retford Hospital is no more. It is a health centre. It's a very, very good health centre. It's only a very good health centre because it complements Bassetlaw Hospital with its accident emergency, with its acute care, with its elective surgery. That's what goes together. If you lose this, what about whether Kings Mill's a good hospital or not? From where I am, Kings Mill, perfectly good hospital. But that's not the point of whether Kings Mill is good or bad, because that can be sorted. It's whether you have your hospital. If you lose your hospital, there are repercussions beyond just Newark. And in my view, the moment that you lose accident emergency, then there is a question mark over the name hospital. It's exactly what Retford found, and I think for the health service of the future, with flexibility, with all the technologies, will require somewhere where you can go for accident emergency in your locality, and where there are beds and other treatments as well. And therefore, it's vital that you fight and win this campaign, because once something's gone, as we all know, it's much harder to recreate it.
John, I'm really grateful to you coming this evening for contacting us in the first place, and giving us the benefit of your experience and your authority on this matter. Can I also say it's fantastic for me to hear a politician so passionate about the NHS who's not got a background in the health service, but you clearly understand the role it has in our society and are a great supporter of it, and that inspires me. Thank you very much. I think the issue here is really quite simple. There are arguments, medical and financial arguments, for downgrading A&E. My opinion is there are stronger financial, medical and social reasons for maintaining and improving the services we have here. And as John says, if they go, it's very hard to bring them back. A&E is like the heart of the hospital. It brings a lot of the work in, it's the first point of contact, and ready access to healthcare is absolutely vital for any society to be thriving and to look after all aspects of society, young, old, pregnant women, really doesn't matter. It's essential that we have access to emergency care whenever it is necessary. I think this is a fight that's worth fighting. I think that it's worth us pulling together, putting party political issues aside, and supporting, not a political party, supporting Newark and the people of Newark. It would be really helpful if those of you that want to consider, no commitments, just consider helping us move this campaign forward. You just leave us your name and a contact telephone number or email address, because some of you we know, others we